Hi, I'm Lindsay O'Rourke, and I'm the Training Program Coordinator with Safe States Alliance. Welcome to the Inspire and Ignite Learning Series. This month, we're focusing on advocating for policy and funding solutions for injury and violence prevention work. This video is our Inspire webinar. In the next 30 minutes, you'll hear from two experts on practical ways to get involved in advocating for IVP. At the end of the recording, use the QR code to fill out our survey and let us know the questions that are still on your mind. And if you want to learn more, join us for the Ignite conversation at the end of the month to talk with other professionals about policy. You can use the second QR code to register for the Ignite conversation, and hopefully we'll see you then.
Hello, my name is Paul Bonta, and I am the Director of Government Relations for the Safe States Alliance. For this month's Inspired Learning and Ignite Conversation series, we are focusing on policy change in 2025 and the impact you can bring. To get started, I'd like to talk a little bit about what we can expect in the next year around legislation affecting you as injury and violence prevention specialists. So let's get started. So what happened? Well, after the elections last November, the Republicans gained control of the White House. They also gained control of the Senate, and they retained control of the U.S. House of Representatives. So they now control all corners of the policymaking arena in Washington, D.C. So this here's a picture of Mar-a-Lago. And the reason why this has been in the news is because industry leaders from across the spectrum have been traveling to Mar-a-Lago because they recognize the importance of building relationships with the president-elect and members of his senior staff. The reason that they're taking the time to build these relationships is because in order to be a successful advocate, you have to build relationships with policymakers. How do you build relationships? It's actually quite easy. You can take the time to schedule a meeting with your elected official back in their home state or legislative district. All members of Congress have at least one office back in their state or back in their legislative district, and they do regularly meet with constituents back home. Or you can submit a letter to the editor, to one of your local media outlets, highlighting the importance of injury and violence prevention programs in your local community. Or you can simply pick up the phone and call one of your elected officials to register your support for specific injury and violence prevention programs in your state. Similarly, you could just send an email to your elected officials stating the same, stating why injury and violence prevention programs that exist in your state are important and the impact that they're having. Now, you might think, an email or a phone call, what's that likely to do? It will take small steps towards facilitating a relationship with policymakers or with their staff. Why? Because come the time when you meet with that elected official or perhaps a member of his or her staff, the first thing they're likely to do is to search and see if Paul emailed my office in support of a particular program, or if Paul's name appears on the phone logs. And if so, they're going to want to know, what issue did Paul contact us about? And so when you meet with that policymaker or when you meet with that staff member, the first thing they're likely to say is, oh, Paul, it's good to see you. I recall that you emailed this office 3 months ago, urging that we support this particular program. So it just really helps open the door towards facilitating a relationship with that policymaker's office. The beauty here is that none of those things require a plane trip to Washington, D.C. However, one of the most important opportunities to take advantage of is the Safe States Annual Advocacy Day, which this year will be held March 20th in Washington, D.C. So yes, for those who are able to travel to D.C., we would encourage you to join with your colleagues in the injury and violence prevention arena to build support for injury and violence prevention programs funded through the federal government. So what do you say? You simply share information about those injury and violence prevention programs that you are most passionate about and that are having the greatest impact in your local community. And importantly, you should discuss CDC's unique role in advancing injury and violence prevention programs, because we have heard that there are some policymakers who feel that CDC Injury Center programs specifically could just simply be transferred over to another federal agency such as SAMHSA. And depending on your work setting, you should also explain the role that your public health department, or perhaps your academic institution or your trauma center, plays in advancing injury and violence prevention programs in your state. So what can we expect in the policy and advocacy arena this year? Well, this is a snapshot of a bill that was approved by the House Appropriations Committee last year. And so if you see here on the left-hand side under CDC Injury Prevention and Control, the House Appropriations Subcommittee on Labor, Health and Human Services and Education proposed eliminating all funding for CDC Injury Center programs. The dashes there that you see next to committee recommendation, those dashes mean that all funding is proposed to be eliminated for these programs. So what can we expect in 2025? We're likely to see this again. So the proposed elimination of the Injury Center appeared not because there are any policymakers who are opposed to what the Injury Center is doing, but most policymakers simply don't know what the Injury Center does. And as a result, it became an easy target. So while it was initially viewed as a threat, the proposed elimination of the Injury Center is actually an opportunity for injury and violence prevention professionals to build relationships with policymakers and educate them about CDC's unique role in advancing injury and violence prevention efforts across the country. Safe States is proposing to lead a targeted communications and advocacy campaign to protect the Injury Center from any effort to either reduce or eliminate its budget. The opportunity here is that never before has there been a dedicated and concerted effort to educate policymakers about injury and violence prevention programs. Yet in order to make this campaign successful, the injury and violence prevention community must join together and educate policymakers simply about the work that you do. There's no special skill set required. Again, you're just talking to policymakers about the work that you're doing, about those injury and violence prevention programs that you know best and that are having an impact in your local community. We can and we must all engage to promote the field and protect the gains that the field has realized with regards to increased funding for injury center programs over the past several years. So together we can do this. And I look forward to collaborating with members of the injury and violence prevention community to engage in the policy making process and ensure that policymakers gain a very clear understanding of the work that you're doing back home and the impact that your work is having on the communities that they represent. Thank you.
Hi, thank you so much for joining our webinar today. I am Shannon Guillot-Wright, and I am an associate professor at UT Health Houston School of Public Health. And today we're going to be talking about the different ways that we can communicate with policymakers, either as researchers or government employees, basically, in your professional role and not necessarily in your personal role. Before we dive in to the webinar, I do just want to recognize at the very beginning that we are in a different place than we've ever been before when it comes to policy and when it comes to the way that research and policy are interacting. And so although whenever we conducted this study that I'll be going into and some of the recommendations that we have from it, this wasn't necessarily the environment that we were in. When it was conducted, it was also during an impeachment trial in 2019. So all of that to say, within the policy space, there's always unknowns, but the heart of this research hasn't changed, which is really about how we build relationships and sustain movement, whether that's local, state, or federal policy. So to start with, we're going to look at the use of research evidence, or URE for short, looking at where it's been and where it's going, thinking about what has worked in the past and how we might need to change our strategies depending on where we are in different political environments or based on different topics, and then recommendations for moving forward. So a lot of my background is in violence prevention and injury prevention, looking at evidence use. And so this research comes out of a 1-year ethnographic study that I did with the Research to Policy collaboration, where we spent time with staffers in Washington, D.C. So this was a federal level study trying to understand what is it that would help move research forward and move data forward within policy spaces. And so I'll be going over some of that data as well as thinking about how things have changed and ways that we can continue working together to bring data into policy. So using science to improve or to create health policies is a multi-level process, and it really requires a good understanding of relationship building, behaviors, problems, different actors, and results. And there's really been 3 generations on thinking when it comes to the use of research evidence. The first generation is linear. So it was really focused on what can we publish and what can be disseminated. The second generation is relational. So do we understand the priorities of policymakers, of practitioners, and communities? And are we responding to those priorities? The third generation has been systemic. So what needs to be in place to support research use in organizations? With each of these generations of thought, it's not that one is taken away and replaced by the other, but it's a building upon. So we still know that we need to publish data and that we need to disseminate data. But we also know that that data can't be implemented in meaningful ways if we haven't built relationships with people. And so a lot of what I'll be talking about today is that relational piece, because even to move into the systemic change of putting different policies in place that can support research use, you still have to have that relationship piece, and it's so important to everything that we're doing. So what does good evidence use look like? So how can better quality use be supported, and what interventions are most effective to deliver this outcome? And that's one thing that we have been studying, and you can see the QR code here. I'm looking at an article that we wrote called What Works for Policy and for Evidence Use in Policy. You're welcome to scan that if you want to dig into this more, but also thinking about what types of interventions have been evaluated in this space already. So again, linear, relational, systemic. What mechanisms do different interventions employ to generate changes in evidence use outcomes? And then how can we measure that? So that was really kind of our guiding principles whenever we were doing this ethnographic study. And to back up, for those who don't know what ethnography is, it's a qualitative research methodology where we spend a lot of time with a group of people. And so it's like the sister to longitudinal surveys within quantitative research. So I did interviews with policymakers before they had meetings with the research to policy collaboration. I did interviews with them after they had those meetings. I went to congressional briefings with them. I sat in on Hill Day meetings and really tried to get to know the staffers in a better way, in a more comfortable setting at times, so that I could better understand what was it that they were needing out of the research community. So the research to policy collaboration, it was started out of Penn State by Max Crowley and Taylor Scott. And the one of the guiding principles that starts RPC is training researchers. So the RPC would train researchers and really try to help different researchers feel comfortable in the policy space. They would use the term experts, and I think that that's a really good reframe as well, that whenever you're thinking about how do we present data, you don't have to be a PhD level researcher. We had students who worked with them. We had people who were in government or were in government previously, as well as various kind of what you would think of as like a traditional advocate, but instead of going in as an advocacy or lobbying role, going in through that education role. They also conducted legislative needs assessments with every office, coordinated Hill Day meetings, and the objective of those Hill Day meetings was really creating long-term relationships between the staffers and the researchers who shared similar areas of interest. So really, again, fostering relationships was at the heart of what the research to policy collaboration was doing. What's really important about what was different with the Hill Day meetings with RPC is that it wasn't going in with an agenda necessarily of saying, like, these are the 5 legislative priorities that our team has, and giving that over to staffers. Instead, it was kind of a flip of the script and going in and saying, hey, we're not policymakers, we're not staffers. We don't necessarily know what it is that you're needing, but we want to be helpful. And so, we study, let's say, child maltreatment generally. Within child maltreatment, what is it that your office is working on? And maybe it was foster care. And so, okay, great. We have researchers who focus specifically on foster care or different experts. And when we think of expertise, it wasn't necessarily, again, someone who's conducted 30 years of studies on foster care, but really thinking about evidence in more fluid and creative ways in how you can get evidence to policymakers, and not necessarily having, somebody in the room who has done this their entire life. And so, thinking about yourself as an expert, whether you think of yourself as an expert or not, trying to, remember that when you're going into these spaces, many of these staffers have lots of different portfolios they're focusing on. And so the fact that you've even read a few articles or done a little bit of research makes you much more of an expert than most people that they're talking to. So the results of what we learned, kind of piggybacking on that, policymakers want research, but they want it in bite-sized forms. We had one person who told us that a staffer told us that a student had sent him their dissertation. It was like, hey, hope this helps. And that's not necessarily helpful, right? How do you get good data to policymakers, but in ways that they could actually use? Some people said if it could be copy pasted into legislation, that would be even better, right? Like maybe it wasn't like fully formed or fully baked yet, but anything that could kind of make their lives easier and get that research into legislation was something that they were interested in. And I'd like to note that during this time, we were working, equally with Republicans and Democrats. Again, this was a federal study, but many of the conclusions that we found and recommendations follow through, whether it's local, state, or federal. We also learned that trainings eased fears and created community bond. So women and historically marginalized populations, such as Black, Indigenous, people of color, typically experienced more trepidation about the policy space. And when we could have something like we're having today, a webinar or a training that lets people know, hey, this is what you can expect. This is probably how long you'll get to talk to the staffer. Here's, in a quick fact sheet about what that policymaker is interested in, then people would go into that phase feeling more secure, and then you would get more diverse opinions and people around the table who may not have historically been around these tables. And so anytime we can get together and talk about what it is that can be expected, it really helps create a more opening and welcoming group of people who are presenting evidence. So we also learned that policymakers were more likely to listen and reach out to someone they had a relationship with. I don't think this is something that's shocking to people, and yet at the same time, rarely do we do the work of building those relationships. And so although not a finding that was like in left field by any stretch, it is something that was really good to remember, that almost every policymaker said, look, if I've met with you before, I'm more likely to reach out to you later. And so having those initial meetings with people, getting to know them in, both a, official 15-minute meeting, but also, going to various events where people are. And, if that means, especially in your local community, going to school board meetings or, going to fundraisers with the school board and anything where you can start to build relationships with people always goes a lot further. That goes in both directions, right? So now you understand them a little bit better and their priorities, and then they know who to go to and who to reach out to when they have a question about something. And it might not be something that's in your area of expertise, and that's totally fine. That's part of this relationship building, is that they can go to you. You are, what is known as an honest broker of knowledge, and then you can connect them to the right people as well. And then also academic systems or governmental systems are not always set up to encourage policy collaboration. So this comes to the systemic changes that we really have to think about when doing this work. Part of that is understanding different requirements. So there's a lot of fear that we found from researchers and governmental employees who were afraid to go to Capitol Hill or to go to the school board meeting or to go to Austin and talk with people because they were afraid that they would get in trouble because they were lobbying. I think that's something that right now, in the moment that we're in, there's probably even more fear and trepidation around that. So it's really important to know the rules and to stay within those guidelines, but then to know that you can still go and talk to your policymakers. Again, whether that's at the local level or federal level. So, one important thing is always thinking education. So, not necessarily advocating or lobbying for a certain bill, but how can you educate a group of people about a certain issue and the people that are being impacted by that issue. And um, so saying, this is the research I have on foster care. We'll use that example again. And therefore, I want you to support SB whatever number. That would be lobbying or advocacy. If you go in and say, hey, we've done a lot of research on foster care, our colleagues have done a lot of research on foster care, and here's what the data and the science is telling us, and then that's totally fine. That's on the education side. So, just making sure that you're not advocating for a specific policy, but instead thinking about how do I get this research and this data in front of different people, and then from there they can take it up in the ways that are the most meaningful. And then finally, policy systems are not set up to encourage research collaboration. So it goes both sides, right? So, there's high turnover and burnout within these different spaces. You might go to a meeting and it could be 15 minutes in the hallway with an intern, and that's totally fine. You got in there, you met with people, and you took the first step of building those relationships. You never know where that intern is going to end up long term. Or it, could be somebody who is, in an unpaid internship or a one-year fellowship, or on the opposite side, a chief of staff who's been doing this for a long time and is just feeling over it, right? And so, there's different ways that we can work to, also make sure that the systems within the policy space are set up to encourage more collaboration. And some of that goes on us. It goes back to some of our first points of making sure that you are presenting data and presenting work in bite-sized forms, so that people aren't, having to go through, mounds of jargony data and research, but instead are hearing directly from the people and constituents who are impacted by this work. So recommendations that came out of this research, and this is a manuscript we published as well that you're welcome to scan or to Google, called Improving the Influence of Evidence in Policy Creation. So keep your message simple, and that even goes to emails that you're sending. Make sure your subject line is very clear, assisting with foster care policy. And within your email, don't attach anything because it could get flagged and go to trash or spam. And make sure it's just 2 or 3 sentences, something that somebody can, read quickly, and then maybe like a website link that can take them to more information, or to, a registration page if you're having a Hill Day meeting. So really keeping your message super simple, whether that's, in a meeting or in an email. Setting your expectations, like I said, your meeting might end up being 15 minutes with an intern instead of the chief of staff or the person who has, health policy or child maltreatment as their portfolio. That's totally fine. This is about making those initial steps and getting to know people. Having those long-term goals set of, why are you there, and making sure that you understand various lobbying rules, and that you are focusing on education and focusing on that relationship building piece is incredibly important. And then with relationships, that means becoming a trusted resource. And that could be through policy briefs that you help create for people. We'll often tell offices that if they need something, we can create it within 48 hours for them. It can be a world that moves slow and then moves fast and then moves slow again. And being able to go and move with those waves can be really important. making sure that you have a good background and strategy before you walk in the office. Going and testifying. Again, you can testify as a government or academic employee, and you can do that in ways where you're not advocating for certain legislation, but you are, educating on various topics that, the Senate or the school board are interested in at whatever level that might be. So to end, I just want to thank you all for being here. I know it is an odd time for all of us, and we're trying to figure out how we navigate these spaces in new ways. At the end of the day, I think what we want to make sure we're doing is that we're focusing on people and not just issues, that we are building relationships and becoming trusted resources, and making sure that we're doing that not just at the federal or state level, but I think now is the time to really think about local policies, thinking about your city councils and your school boards and different governmental committees that family, children's, and youth boards, getting on those boards, being part of them, and building those relationships with people is going to be really important as we move forward in these spaces, and make sure that science is still centered in what we're doing. And so if you have any questions, you're always welcome to reach out to me via email. Also, you can follow me on Blue Sky and our Instagram page, People Centered, where we are oftentimes posting different work that we're doing in the community or at the policy level. I'm excited to get to meet with you all soon and hear more about your concerns or your questions, and kind of walk through this together and talk through it together and come up with solutions together. Thank you so much for being here.